Clubbing refers to the bulbous enlargement of the distal phalanges of the fingers and toes due to proliferation of the connective tissue beneath the nail plate. So like this is the side view of a phalanx, this is the nail plate and this is the nail bed. And now if there is a proliferation of the subcutaneous tissue between this nail plate and the bed, then and this leading to the bending of the plate in the form of a bulb is known as clubbing. So first you need to know, how do we know if the clubbing is present or not? Like if there is gross proliferation of the tissue between the nail pit and the nail bed, you can grossly visualize the clubbing, like in this case. Whereas if the proliferation is in early stage, you might not be grossly able to see the clubbing, so you have to use several methods to look if the clubbing is present or not. The first of this is the fluctuation of the nail bed. As the proliferation occurs between the nail plate and the nail bed, the adhesions between the plate and the bed decreases. So if you check the fluctuation of the plate, so the side to side fluctuation will increase. And how will you look for it is, you will place 2 of your thumbs below the nail, 4 of your fingers on the distal joint and 4 of your fingers on the proximal joint, and you will look for the side to side mobility of this plate, and it will be increased in case of clubbing. Second is the Lovibond angle. So the angle between the nail plate and the proximal skin is usually less than 180, whereas if it is equal to 180 or more than 180, it is suggestive of clubbing. The third one is the Shamrock window. If you ask the patient to oppose 2 of the distal phalanges of the index finger, normally there is a diamond shaped window present, that is the Shamrock window, whereas in case of clubbing, due to increased proliferation, this window is obliterated. And last one is the phalangeal depth ratio. Normally if you measure the side length at the level of the distal phalangeal joint and the side length at the level of the root of the nail, so the length at the level of the distal phalangeal joint, that is the interphalangeal depth, is more than the distal phalangeal depth at the level of root of nail plate. Whereas in case of clubbing, due to increased proliferation, this distal phalangeal depth will become more than interphalangeal depth, that is the ratio will become more than 1. So these are the different ways in which you can know whether the clubbing is present or not. Now what can be the different causes in which there can be clubbing present? Like if the patient comes with clubbing, what will the different causes you will think of? So there are various mechanisms and theories which can explain the clubbing in different causes, out of which the most important is the theory of hypoxia, which says that if there is hypoxia occurring in the body due to local release of the increased growth factors like the vascular endothelial growth factor, there is increased proliferation of the vessels as well as the connective tissue, then that leads to clubbing. So hypoxia can occur either due to respiratory conditions like an lung abscess, bronchiectasis, cystic fibrosis, empyema, lung cancer, mesothelioma, or interstitial lung disease, or it can occur due to heart diseases like the cyanotic heart diseases or the acyanotic heart disease with Eisenmengerization. What you have to very importantly notice is there is no clubbing present in case of COPD, as well as the tuberculosis itself doesn't cause clubbing. In case of COPD, if you are getting clubbing, then it is suggestive of an underlying lung cancer, whereas in case of tuberculosis, if you are get clubbing, it is probably due to secondary fibrosis or bronchiectasis. So these are the most important causes of clubbing. The next theory is that whenever there is a local platelets coming to the nail, the platelets with them bring the platelet derived growth factor, and this growth factor then leads to proliferation of the tissue leading to the clubbing. And how will this platelet come to the nail? It can come as an emboli, like in case of infective endocarditis. So that's why in case of infective endocarditis there can be clubbing present. Also, it has been seen that in cases of chronic inflammation occurring in the body, there can be increased growth factors and vasodilator in the blood, which can again go to the nail and lead to increased proliferation of the tissue. And it can occur in disorders like hepatic cirrhosis, inflammatory bowel disease, and celiac disease. Another theory is the neurogenic theory, which says that whenever there is increased parasympathetic nervous system activity, there will be increased vasodilation, leading to increased blood reaching the nail, taking more factors along with it, and again will lead to increased proliferation of the tissue. And the last one is the congenital theory, in which there is a disorder, that is a pachyderma periostosis, in which there is inhibition of the prostaglandin dehydrogenase. Prostaglandin dehydrogenase normally decreases the level of prostaglandin, the active prostaglandin. So as there is inhibition of this enzyme, there are increased prostaglandins, which increases the vasodilation at the level of nails, and thus increases the proliferation. And it has a characteristic triad of hyperkeratosis of palms and soles, leonine facies, as well as clubbing. So these are the different causes and mechanisms in which and by which the clubbing can occur. Now once we find the clubbing, we have to grade it. So there are 4 grades for clubbing. In the grade 1, we have fluctuation present. We grade it as grade 2 if the Lovey bond angle is more than 180 or if the Shamrock window is obliterated. Whereas if a parrot beak or a drumstick appearance is present, this is the parrot beak appearance, and this we have seen earlier is the drumstick appearance. If this is present grossly, then we grade it as grade 3. Whereas if there is a hypertrophic osteoarthropathy, in that case we grade it as grade 4. Now this hypertrophic arthropathy is distal to the joint, distal to the nail. There is increased hypertrophy of the joints due to the similar cause that had led to the proliferation of the tissue of the nail bed. Similarly, the increased growth factors are causing the proliferation at the level of joint, leading to hypertrophic osteoarthropathy. And if there is hypertrophic osteoarthropathy present, it is highly suggestive of bronchogenic carcinoma. What happens is, in case of bronchogenic carcinoma, that is a adenocarcinoma, increased mucin is released into the blood, which leads to thrombosis, and increased accumulation of platelets will bring more platelet-derived growth factor and will lead to proliferation of the tissue of the nail bed, and then will lead to clubbing, and as well as these growth factors will lead to proliferation at the level of joint, leading to the hypertrophic osteoarthropathy. So this is how you can grade the clubbing. Now there are some peculiar things that you need to know, like the differential clubbing and the reverse differential clubbing. There are similar like the differential and reverse differential cyanosis. Like in case of differential cyanosis, there was lower limb cyanosis present. Similarly, due to same mechanism, that cyanosis happened due to hypoxia. Due to that hypoxia, proliferation would have occurred, leading to clubbing of the lower limb, and this will be seen in patent ductus arteriosus with Eisenmengerization, whereas the reverse differential clubbing will be seen in patent ductus arteriosus with Eisenmengerization with transfusion of great arteries. If you want to know the mechanism of this, you can refer to the video of cyanosis. Now there can be some causes in which there can be unilateral clubbing present. Like in case of subclavian cervical rib, there will be compression of the artery on the one side, leading to hypoxia of one of the limb only, and then leading to clubbing of the one limb only. Similarly, in case of subclavian artery aneurysm, there will be aneurysm present on the one side only. Thus, the emboli from that aneurysm will be going to the one limb only, leading to the unilateral clubbing. And in hemiplegia, due to neurogenic theory, there is a clubbing present only on the side where there is paralysis present. Whereas there is another term which is a unidigital clubbing, that is the clubbing is present in only one of the finger, and it has been seen in case of median nerve palsy, or it has been seen in case of repeated trauma to a finger, like it occurs for a jackhammer users. So these are some peculiar things that you need to know about clubbing.